So, Doc, is the disease hereditary? Can one pass it to their children?
The majority of the conditions are not directly transmitted genetically to the offspring. There may be some remote likelihood that if your parent has it, then the children and the siblings are more likely, but that is remote. But there are some which have got genetic linkages. But the ones with genetic linkages also are kind of like confined to particular communities. Yeah, there are some genetic makeups which predispose some patients to particular diseases, but they are not as common as the ones which are not genetically transmitted. There are a few. So majorly, you don't pass the rheumatic conditions to our children, but there are others, particular diseases, which as we go on, as we tackle the rheumatic diseases, we'll be able to talk about. But majority of them, especially in Africans especially, the majority of them are not transmissible. The transmissible conditions, majority of them are not in Africa. Yeah.
So, Doc, what is the role of physical exercise in either prevention of the disease or just managing the disease?
Now, okay, rheumatic diseases and physical fitness. Physical fitness plays a big role in treatment and rehabilitation of the degenerative diseases, mostly. Okay,
So when you say
but
degenerative, what do you mean?
diseases which involve aging and deterioration of the joints and musculature. Okay, the musculoskeletal system. Yeah, physical fitness can help prevent, and if already they are there, it can help in the treatment and rehabilitation from those degenerative conditions. But inflammatory conditions, when you have an inflammatory disorder at the height of inflammation, like say inflammatory arthritis, when the inflammation is raw, physical exercises will do more harm than good. Yeah.
So you have to be careful.
You have to control the inflammation. If you have rheumatic disease, you talk to the doctor, he will tell you what to do. Yeah. But normally inflammatory arthritis, I tell them we treat the arthritis first when it is quiet clinically, and we have done laboratory tests and we've seen there's no inflammation. Then you can guide us, be as fit as anybody else. Yeah. Because physical fitness is good for everybody. Yeah.
So, what are some of the common examples of this disease in Kenya?
I will not go into a lot of theoretical long list, but I can talk about the conditions we have around here, because that will be the most important thing to alert people around here. Diseases like osteoarthritis is a degenerative joint disease. Worldwide, it is the commonest form of arthritis. Arthritis in general, osteoarthritis, that is the one of aging joints. Okay, so it's very common. But now, around here, we also see a lot of inflammatory arthritis, like in adults, painful swollen joints. Inflammatory arthritis is more common in women. Autoimmune disorders majorly are more common in women than men. Some of them in a ratio of 2 men to 9 women, like in lupus, the ratio can be that high. It's more common in women, and it is common here because it's a disease where every day you don't miss seeing several patients, not one. Okay, rheumatoid arthritis is also common, but because we've not done a study in the population, general population, to determine which one is the most common. From where I sit these days, I see lupus coming in more commonly than even rheumatoid arthritis. But we have rheumatoid arthritis, we have lupus, we have connective tissue disorders in general, we have overlap syndromes, which is something involving more than two autoimmune diseases. You can have, like the common one is rheumatoid arthritis plus a connective tissue disorders in one patient. Okay, so those are common things. Then the juvenile arthritis are also common. Gout also is common. Okay, then in the other systems like the muscles, we have what we call inflammatory muscle diseases, polymyositis, dermatomyositis. Those are also present. We see them less commonly than the other diseases I've talked about, but they are there. Yeah.
So now let's talk about finding you. How can one find you and get your services?
I think I'm making it easier, more and more easier for people to find help by, first of all, going online. Just when you Google either my name or the clinic, you will definitely find me. The directions are there. And then again now on Facebook. If you go on Facebook, again, Comprehensive Rheumatology Clinic is on Facebook. And I'm also on Facebook. And my contacts are there. Things like telephone contact numbers, because they are there in the website and on Google. 0728 820 209. 0728 820 209. If you call that number, you will be good to go. Right. But we are located at Corner House, 4th floor. This is in the CBD, Kimathi Street, just opposite the Kimathi statue. Directly opposite Kimathi statue. 4th floor, room A10.
Now, Doc, would you be available in creating awareness to the public, in schools or churches? How available are you?
I've thought about this and even floated it to the authorities concerned. It takes time to do. And then again now, COVID is there. People doing things from home. And so I think what we are doing today is a better way. If we can locate schools online, if you can locate school websites online, or anyhow where you can reach the youth, we are going to work on that to see whether the interviews we are going to do can be made available, can be made accessible to schools, to churches, because those are some of the ways of passing information to everybody. Yeah, churches and schools and colleges, including university colleges, if we can be able to get them to watch some of the interview, because they watch a lot of things online, social media all the time. So if they can focus on this for a short time, then the information will be there for everybody. It's the best way. The best way.
So in institution,
on your phone, you can be able to watch us. Yeah.
So an institution that would like to invite you, you are available.
Available. Yeah.